Um, so we are, this is going to be an interactive session, and I would want us to use the chat box. If you have any question, please use the chat box and let us know. If you don't want to post publicly, you can message me privately with the Zoom chat box. All right. Dr. Ife is on the line. So we're going to be having this session together. And so I'm Titilayomi. My name is Titilayomi. I'm a doctor. I'm working here in Hungary. And Dr. Ife as well is working in Hungary. Please, can you introduce yourself?
Yeah. Hello. Hi, everybody. Can you hear me?
Yes, we can hear you, doctor.
We can hear you.
Okay. All right. My name is Dr. APANISE Ifeoluwa, a Nigerian. I've been living in Hungary for some years now. I'm an ENT surgeon, head and neck surgeon. Also, we call it otolaryngologist. Also, I'm a general practitioner, like a family medicine doctor. So for years, I have covered a lot of clinical experience, like not just in Hungary, in Ireland and States as well. So I'm very happy to be here tonight to talk about various issues or medical cases, even if it's going towards medical insurance as well. We can talk about everything. So please feel free. You can ask any question and we will try to help.
Thank you. All right. So first of all, we just want to give an highlight of what we'll be talking about: medical checkups, first aid, TAJ Card, as we're aware this is the national insurance scheme of Hungary. So, and also private insurances. And we'll talk about maybe some procedures that, are available, or if you have questions on procedures available in Hungary. And I want to mention that when we're talking about health is the state of complete physical, mental, and social well-being, and not just merely the absence of diseases or infirmity, according to the World Health Organization. So it is a broad, is a big umbrella where everything falls under, and not just because you don't feel sick, but somehow you may be lacking in good health. So we're going to talk about different things and also give advice. And we pray that by God's grace, as we pray that the Lord will enlighten us and be able to use this knowledge and implement them in Jesus' name. Amen. So we're going on to medical checkups now. What are medical checkups? Why do we need medical checkups? And as I know, medical checkups are necessary and we need to follow through with that. So Dr. Ife, can you give us
Yeah.
some insight?
Thank you. Thank you so much. Yeah. As Pastor said already, like you already gave a lot of information, but before I even jump into the medical checkup, I would say everything starts from the mind, you know. So like health is basically your mindset. So I think one thing we should learn tonight is for people to have a different mentality, different orientation, different mindset. Because I'm also talking from my own family experience, whereby family members feel like, you know, okay, when we don't have any problem, then why should we do medical checkup? Why should we see a doctor? Why should we do anything? We only seek doctor when we have a problem. So like, oh, okay, I have this pain. Oh, let me use Panadol and just see. Maybe it's gonna go away. Don't need to see a doctor. And when there's a last minute, then we start rushing to hospital. So even it happens in my own family as well. So I think it's totally wrong. Now, medical checkup is very vital that I would recommend yearly or even twice in a year. When I mean like medical checkup, I'm talking about um, thorough, complete blood work, like a blood test, full blood test, covering everything. Now, there's another part of medical checkup I want to talk about, which it should be available at home. I don't know how many people listening to us right now. I don't know how many people have blood pressure measurement at home. I don't know how many people have glucometer, blood glucose measurement at home right now. It's not a common thing. You'll be like, oh, what's the point? Yeah. is very important. Now, somebody will say, I'm 20 years old, I'm 30, I'm 40. Why do I need to measure my blood pressure? Why do I need to measure my blood glucose? These are basic vital signs. Even in Ireland, you can go and buy blood blood glucose or blood pressure measurement for free. Like they will just give you for free like that because they know how vital it is. Almost everybody have it at home now. The point I'm trying to say, you could be 20, 30, 40 years old and say, I don't need to check my blood pressure, but that's totally wrong. Why? People now are dying at the age of 60, 50 due to stroke or many other diseases. The stroke is a chronic illness. Stroke didn't start like in 1 year, 5 years. The basic medical condition leading to stroke is hypertension. Now, with the increased daily life stress, now, even as a student, it could be 20, 30, you have stress, anxiety, and it's not maybe stable, maybe it's kind of like changing, but that pre-puberty, you have so much high blood pressure and you don't even know. I've seen somebody that's 30 something years old that have a blood pressure of 180 and they didn't know. So the thing about medical checkup is that if you find out some things early, it doesn't mean you should take medication to reduce your blood pressure. You could have a lifestyle changes, or you could do some things. But at least if you know, you can start to solve it earlier. Or if somebody have a high blood glucose level, if they find out earlier, then they could probably start treating it before leading to diabetic ketoacidosis or bigger illnesses. So that's where the problem is that we should not think, okay, I'll start considering that when I'm 50 or 60. No, we should start checking it as early as possible. And according to one of my professors, he said to me, most of these cases, if you find out on time, early, and you solve it, let's say you have high blood pressure at the age of 30, and maybe a lifestyle modification is necessary and you can bring it down, then you're preventing future chronic illnesses. So medical checkup is very, very important and vital. And let's forget about that. Now let's go to blood work. You should do a thorough blood test whereby we can see if it's maybe cholesterol is high, maybe triglyceride is high, maybe it could even be like a kidney function that maybe it's genetic kidney problem, you could detect on time. Maybe liver function, you could detect on time. And also, you should do chest X-ray. Most time, people that are working, they know they do yearly chest X-ray, like to see your lungs, what's the current status of your lungs, any fibrosis, any infection, anything in your lungs. So these are the complete uh, medical checkup that's necessary, even without any symptoms of sickness. And that's what we should take serious. And also for guys, like for male, we should do PSA, that's prostate checkup, like in the blood is PSA from the age of 40. And for female, they should also do correct medical checkup. I'm talking about breast and also cervix examination. So all these checkup are very important, So I'm just leave it there.
Okay, thank you very much. That's a very good breakdown of our medical checkups. The blood work is important. Many a times when you go to the GP and you want to do a normal medical checkup, they check your liver enzymes, they check your kidney status. You can see that in the values that you get after the laboratory work. And high blood pressure is a silent killer. So the earlier you detect it, the better. So we have this blood pressure monitors. You can buy it even in probably Rossmann. So it's easy to get here. So please, you can have that in your first aid box. I'm going to talk about first aid. So blood pressure measurements, glucose measurements, and please ensure that you use the resources available to you, especially with the privileges we have here in Hungary, the TAJ Card and students or private insurance. So that's our next segue now. What privileges do we have in Hungary? As someone who is working, you're paying your taxes, and a portion of your deductions is going towards the health insurance. That's the TAJ card that you have, which has your social security number, and you have the opportunity, you are able to walk into the hospital and seek medical advice or consultation. So what privileges does the TAJ card offer us here in Hungary? And okay, we'll talk about the TAJ card and private insurance as well.
Yeah. Okay. For TAJ Card, that's the public health insurance. I think is very, very good if somebody can have that because it covers almost, I think, everything, but it's divided into different categories because if you are a Hungarian citizen or you are EU citizen or you have a permanent residency, then the coverage is a bit different and the expiry date is different. And if you pay taxes and you have a job, and from your job they could offer you a they pay for insurance, then it's also good. Obviously, having a Thai card, you can basically do everything. You just walk into public hospital or clinic, and they should attend to you. Now, obviously, your first line or primary line of treatment is your GP, which is the family medicine. You should have a GP. You should register to a GP based on where you live or where you stay. And when you're in the system, your GP puts on the system, and they put your Thai card on the system. And anything you need, you can just contact your GP. Let's say you want X-ray now, you just call your GP, and they can give you the
Appointment.
belt along or what. I don't know. Get come to my brain. Like, they give
The
you the
referral.
referral. Thank you. Yeah, they give you the referral. So, or let's say even if you want blood test, you just call your GP, and they can sort it out for you. Then if you need advanced medical checkup, then they will send you to the relevant place. But having a GP is very important. Now, the question is, if people that don't have a Thai card, that's a different story because if you have a private insurance, especially if you're a student, then I think student you have a doctor that's actually
It's university doctor
different doctor that you can go to,
assigned
you
to.
know. Yes, so you can go to, and from there, that doctor will now send you to appropriate place. So basically that's it. But I think also there's another thing I didn't mention. Well, we didn't mention another card is called European Health Insurance Card. So this particular card, if you have a Thai card, you can also apply for this. Let me speak slowly. European Insurance Health Card. That you get that card is a blue card. You just apply online. That card, anywhere you travel in Europe, let's say you want to go to Croatia for holiday, and you have Thai card. Now your Thai card is not valid in Croatia or in Austria. But if you travel to Croatia with the it's a European Union generalized health system program, whereby if you go to Austria, you go to Croatia, and there's an emergency case or anything, if you show your card, you can get treatment for free. Now, they won't treat you for chronic cases. So you can't just say, oh, I'm going to Croatia. Okay, I want to do appendectomy. So they won't do that. But if you listen on holiday and you have trauma cases or anything, emergency case, they will attend to you for free. I've seen a lot of patients that comes over to me with that card and we treat them. Like they have, let's say, tonsil abscess, which is like acute case, and we treat them like without them paying, even though they have private insurance. So also that card is also necessary to have, you know. But private medical insurance is another story. So
Okay. We have some questions here. So can we list the checkup list? Some for men. So it was mentioned the PSA, the prostate screening antigen. So this is seen in the blood work. So for you, there is also the rectal digital exam. So once you go to your GP, you mention, okay, I mean, even if they don't tell you, but as at the age of 40 onwards, it's better to have those checkups. So the PSA exam, rectal digital exam, and the doctor knows what to, write for your lab works or what to check up what the laboratory needs to check up for you when you go for your blood draw. How often should the blood work checks be done in a year? In a year, we mentioned about 2 years, two times a year, and you usually some jobs have the opportunity to have every 6 months routine examination and 1 year chest x-ray. So this is covered by the TAJ card. You go to the GP, they book an appointment, or they tell you, okay, go to this place at this time. The laboratory is open from 9 to 12. Go with your paper, do your blood work, and also urine test. So this is included in the blood in
Yeah.
the lab screening or normal medical checkup. They check your urine. We see if there is any infection, if you are going through anything at all. You can also see through the urine. It is covered by the TAJ card and private insurance. Do you want to add anything to that?
Yes, yes. I think what you said is totally perfect. But another thing is to consider that this is routine medical checkup. But if you have any problem, any case, let's say you have chronic cough, that is not okay. You do, let's say in a year you did already X-ray and it's fine. But after like let's say 2, 3 months later, you have chronic cough and you tried everything and you're not getting better. Obviously, you can ask for test again because now you have a valid medical reason for it. You go to your GP and GP can say, okay, yeah, it's indicated for another examination. So any case that come, any acute case that come up, it doesn't stop you from seeking help. This particular medical checkup is just if you don't have any symptoms or any signs, nothing, but you just feel like, okay, yeah, let me just check myself up. That's what it's all about. But if you have any case, any issue, please go out and seek help. Don't let us be the type that wait to like last minute and now we start rushing or calling ambulance or having the case already been advanced. We shouldn't do that. We are in this environment whereby the medical system and the medical facility and infrastructure is really, really good. So we should take advantage of that. But before I even go further, let me just break it down. My thought about health in the sense that health apart from the spirituality part of it, it's also our knowledge and also our, our part of it, which is the exercise and quality of life. So the pastor already mentioned about food we eat, water we drink, and many things. So it's very important because what you take in your system actually have effect. And we're not even talking about where do you live, the ventilation in your house. Now the weather is cold. Do you actually have a good airflow in your house? How much water do you drink in a day? And what food do you consume? Like do you take care of vitamins and minerals? Do you take care of food supplements? And that question is exercise. Exercise is not about you want to look good. It's just for your health. And when I mean exercise, it's not about going to gym and be carrying weight and just have muscle. It's about being fit. So it's also helpful mentally. Or if you're a student or you're working, maybe you just go early in the morning before going out. Wake up in the morning after praying, go for a jog, run on the streets, fresh air. Let's say 30 minutes. You just or as much you can do, just do. Come back. If it's not even running, if your thing is swimming, you go and swim. If your thing is cycling, you go ahead and do it. So and it's not even just for your physical health, it's also for your mental health because you sweat, you release a new hormone, endorphin, serotonin hormone is being released. You have this kind of feeling of good well-being. And so all this is complete lifestyle that we should focus on. And that thing also is stress. We live in an environment whereby it's so stressful. You could be student, you could be worker, you could be working, whatever. But stress, you need to know how to manage stress because most times stress comes into our system, we don't even know it. And we feel like, oh, I'm young, I can handle it. But after some years, we come out, start seeing the somatic effect of stress. It could be high blood pressure, it could be palpitations, it could be anxiety, it could be come in different forms. We need to manage stress. What I'm saying is that if we need to uh do so if you need to go to holiday let's say, good vacation to distress, if you need to do things to just, you need to think about money, stress management as well, because it's also very important. That's it.
Yes, thank you very much. It's important that we manage stress properly. We go through several decisions every day, and it's important that we are conscious about overthinking and anything that may just add to our stress. So if you don't want to be going to the gym, maybe you can pick up some sports, swimming, tennis. Some apartments have facilities for, sports. So make sure you use that. And most of the time, many of our offices have a gym, have sports facilities. So make sure you utilize those resources available to you. These are ways we can manage our health. So when we talked about medical checkup, so this is regular and routine checkup. If you feel, oh, I don't have any serious disease or chronic disease at that time, it is still important to check yourself up, buy blood pressure monitor your blood pressure, go to the GP, do routine blood work and all of that. But if there is an acute case or a chronic problem, make sure you go to your healthcare provider immediately. So it's not that until it's only 2 times a year I can go to the hospital here in Hungary. No, but
No.
it's important that you regularly check up if you are in good health, and if anything comes up or if you are managing any form of disease, please go to the hospital regularly. And so we talked about the TAJ card available as for workers and for students here. I know some people on scholarship are allocated TAJ card as well, but many of us or many students have the opportunity to have private insurance. And the one I know of is there's a company here that offers private insurance for students here in the university in Szeged. And the only thing is they need to do is to book an appointment with the university doctor. And from there, they can get referrals for further treatment. So as students here, do not feel like you're unable to get healthcare available to you. Please ensure that you get your insurance, your private insurance provided by the school. You pay for it. Sometimes it's included in your tuition fee. So make sure you're aware of that. Ask the secretary, get your insurance, and go to the hospital or to the GP are the first, like the gatekeepers of the medical system. So they know where to direct you to. So make sure you utilize that. And so before we move on from this, we have a question about, can someone walk into the hospital or any pharmacy like it's like back home to check your blood pressure for free? The blood pressure monitors are usually affordable. So if you need to check your blood pressure regularly, you can buy one for the house. But yes, you can go to the GP, and I mean, this is your part of your routine checkup. Not only blood work, they check your blood pressure, they use the stethoscope to check your lungs and everything. But ensure that you book an appointment. Sometimes not every hospital is a walk-in freely sort of thing, or you call the hospital, you need to book an appointment. Sometimes they're out of hours, maybe in the morning or in the afternoon. So ensure that you're
Let me
going at
just chip
that
in.
time. Yes, please.
Sorry, to measure your blood pressure, I don't think in Hungary, what I think is that you can't just go to hospital and say, "Oh, I want to measure my blood pressure," because I think hospital is really busy and those guys won't really have time for you, to be sincere. So because they feel like it's too basic, that
Yeah.
why are you going to hospital? So like you can actually buy it. Yeah, I mean, it costs, I don't know, 3,000, 4,000. You can have it at home. If there's automatic one, it's so basic. You just put it on and that's it. And within a few minutes, you already have your measurement. And most time, we even tell the patient to have a book. They have a booklet, and they write down. Let's say most of my patients, they have a booklet and they write down their blood measurement. And based on that, I can actually analyze or modify their treatment. So I can't be doing it for them every time. So they come with a maybe 1 week measurement, and I can say, okay, in the morning, this is how much it was. Okay, in the evening, okay, now we're good. All right. okay, let's change or what. So basically almost everybody have it now at home. I think it's something we should have at home as well.
Yeah.
And but if you don't have it, you can just go to your GP. GP will do it for you like with no stress. So that's it. But if you go to emergency department or you go to any outpatient clinic, I think they won't attend to you. Just say, let's measure your blood pressure. Let me be sincere. I think they won't attend to you.
Yeah. So how does one register for a GP?
Yeah.
Okay, please go
Yeah,
ahead. How does
yeah,
one?
for that, to register for a GP, first is your address card. If you have a Hungarian address card or address slip, and you have your Thai SAM or Thai card, based on your location, you can call for your GP. If you, so let's say you live in Budapest, you're in district, let's say 17, and you can from that you can if I ask around from neighbor which okay actually you have freedom to pick any GP you want. You can ask around which GP you want to register with, so you're not bound by location and say okay this is the only GP you must have. So sometimes we even ask around like, okay, which GP do you use sef? Maybe I move to a place and I ask my neighbor, which GP do you use sef? Oh, this is the GP I'm using, is a really nice guy, blah, blah, blah. Okay, fine. We just go to that. So you just walk into the based on location, there's always a health center in every district or every city. You will see they always place it like Ovroshrendelo. In Hungarian, it's called Ovroshrendelo. So you will see it, you just go there, and you will see the time outside on the door. They will show you their working hours. So GP most likely works like maybe 3 hours or 4 hours a day. So you see maybe on Monday is open from 4 to 6 or 4 to 8. Then when you have time, is for the first contact, it's safer to go there personally and register with them than just calling on phone. So I would say when they open, you just go there. You will see the assistant, which they will ask you for your documentations and everything. Then they will put on the system. They will check that your Thai card is invalid because your Thai card have different codes, so green, red, whatever, and they want to see that it's on green sign. If it's on green sign, it means it's valid and the no restriction, and they will just register you, and from that moment you're on the system. So that is now your GP. It's very important because if you not only about needing referral or medical checkup, it's also important if you're working and you need like a sick pay or or any benefit, any government or social benefit, it's good to have a GP that can actually sign the paper for you. So that's just the way to register. So that's straightforward.
Yes. So you every what we live in a place where it's really organized. So you go to the maybe for the first contact, you may not be in the right GP place, but they will direct you and tell you that this is the GP for your area based on your address. So you go to the GP, get registered, and from then on, you have their phone number, call and ask for an appointment that you need to see your GP. All right. Brands about blood sugar or blood pressure measurements. I think with that, it's possible to check online like which brands are available at the shop at that time. Well, I guess they do a good job on so you can check the prices and see the one that you can afford and maybe check online about their durability. But it's a basic healthcare equipment that you can have for yourself at home. All right. How about those who are out of a job and they are not, they don't have a valid Thai card at the moment? And what about those who are not insured? Because even as students, sometimes there's an option of not paying for insurance. So how can we go about it here in Hungary?
I think it's very risky to not have any form of medical insurance. It's totally not advisable. So if you have a Thai card, but you don't have a current job, and this way you don't have a job that can sponsor or pay for your social security benefits, there is the option of and but if you have permanent residency or any form of residency, you have address card and you have Thai card, there's an option of you paying for yourself. I think if you are EU citizen, if you have address card or permanent residency, I think the price last time I checked was 8,200 forint monthly for those people. Now, if you are a third world country and you don't have Thai card and you don't have insurance at all, it's expensive. They, the government was asking for half of the minimum wage. So that's how much you should pay monthly, which is probably 40,000 or more monthly. In that case, that's a lot. So that's why if you don't have Thai card and you don't have insurance, it's better to get private insurance because private medical insurance is way cheaper in that sense. And there's so many options online. You can have generally, you can have like Alliance, so many options. I don't even want to start mentioning. Even if you go online, you can the way you do your car insurance or house insurance, you can just go online and you can just see and which one is which one is given good price and also the coverage. You have to consider the coverage that premium coverage that it covers a lot. But it's very important to have insurance. It's not because in life, in as much as we pray and hoping nothing happen, you can never know. So you don't want to take that risk because if you don't have insurance and something happen in hospital, I tell you the payment is a lot. It's a lot of money. I don't want to start giving you guys bill, but it looks many small things you do insurance, you think like it's not a lot of money. When you do insurance and they say you should pay by cash, you will see the bill, you'll be like, you won't believe it. So you shouldn't even go there. So it's very important to have insurance.
Yeah. So it's risky not to have insurance. And I know for students, you pay um, per semester. So that covers that semester. So God is Jehovah Rapha. At the same time, He has given us wisdom, and I pray that we take note of this knowledge and implement it. So it's important that you have healthcare insurance, and do not feel that because you don't have insurance, you wouldn't be attended to. So even if you don't have insurance, or you made that decision not to have insurance, or something happened in the moment when you were in between insurance, go to the hospital. They attend to you. They won't turn you back. Well, you would pay after the care and consultation, then the bill will come after. They wouldn't turn you back. They would attend to you at the emergency. They just give you the paperwork and you go on with your day. All right. As we mentioned, health is the complete well-being, physically, emotionally, even mentally, not just the absence of disease. And our mental health is important in every day, not only in this day and age. And I want to point out that there are opportunities that are available. Even I'm also talking to students here because I know some information about this, and I know here like there are psychologists or people that you can talk to that the university, for example, the University of Zagreb has provided each year as like a mentor or a leader. So make use of these resources, of these opportunities available. If you need to talk to someone, I think there are about three sessions that are offered to students. It's just about not knowing, but it's important to know what your university or what your school offers. So go to the psychologist. If you need to talk to them, all these are bounded by patient doctor confidentiality. So do not feel that your situation is going to be broadcasted. So there's the confidentiality in that. So make sure you know the opportunities available that your university provides, and if not, use the mentors that are there. Sometimes you just need to talk. You need to talk it out and seek help. So our mental health is important. Do you want to add anything to that, please?
Yeah. What I want to that is also the lifestyle is different here compared to like in Africa because back home you have a kind of vast social network like friends, neighbors, uncle, sister, everything. But here everybody just kind of keep to themselves. It's more like conservative environment. So it's possible like you live in a flat and nobody even know you living there
Oh,
and you kind of be
exactly.
depressed inside. Like I remember my first Christmas. Like I used to say to everybody in this country, like I was just at home alone, alone in Christmas. Nobody even cared. Like nobody even knew I was in the
Your
floor.
door.
And I was missing up Nigeria, thinking like back in Nigeria right now, somebody would have knocked the
Knock
door,
on the door, yeah.
like
You do
bring
right.
food, rice, or jollof. You can't just be dull back home. But here's a different story now. We should also, of course, we have to adjust to it, but we should also take care of it in the sense that we should grow our social network. Like some friends you could have, some colleagues, if it's and some things, activities we could do that we should not just be at home and just be depressed, or some things we could just do some, if it's like we play like football, you go and play football with some of your friends in the indoor or outdoor, or you could like to, as you said, tennis, you like to play tennis, you meet people, you go out, like do some sport, and you can have social network, like not just to be at home and be depressed. And also it's good to have mentorship, like if you have somebody like a mentor that you look up to, you can call. Even as I am now, I still have some people I call. Like if I have anything, I call them like, hey, what's going on? So you need that network. You need that social and environment around you to guide you and help you. And sometimes I even invite people to my house, or I go to their houses and we do things together. So we need to take care of it, and it's very, very important.
No man is an island. So as much as you grow and you feel you're independent, we all need someone. So make sure you utilize it, you build your social network, you talk to friends, have mentorship um, available that you can always seek help. And you can always, also go to your GP and mention what is going on with you, and further referrals will be made. But do not do life alone. Everyone, we're here to support you. We're here to do life together. Oh, so we mentioned first aid would be one of our points of discussion. We already mentioned one instrument that we need in our homes, that's the blood pressure measurement. So what else do we need to have as individuals to have in our homes as first aid?
Yeah. I think everybody should have a first aid kit. It's very important. Even when I'm traveling, I usually travel with my first aid box. Like, it's very important apart from blood pressure measurement or equipment, apart from blood glucose, we should have basic things like bandages. We could have something like cotton bud, or we could have something for disinfectant, like betadine or octeniset. We could have plaster. You could have like a compression gauze. I'm talking of in case there's any injury or any cuts and there's kind of mild bleeding, at least you have something to compress the blood or the vessel before you call ambulance or before you do anything. So these are just basic things we should have at home that we could basically use now. In Europe, it's a different setting in the sense that, for example, before you have your driving license, they teach you a basic health stuff. So I think everybody should know how to do CPR. So it's not you don't need to be a doctor to know how to do a CPR. What I mean, like cardiac resuscitation, we watch film a lot and we see like somebody have, even you could be walking on the street next to the tram, somebody just collapse and you think, what should I do? So it's a basic knowledge that at this age we should know how to do. Like you don't have to be a medical doctor. You could be at home, maybe something happened to a family member, maybe they're in the kitchen cooking and something happened and they just fell on the ground before you even call ambulance or call anybody, before they come, you have like 2 to 5 minutes to could have done a lot of help, which is basic thing, chest compression. That's it. Chest compression, if you can't even blow to the mouth, chest compression, 30, two to the mouth, 30, two to the mouth. It's just basic things. So these are these are kind of like a mild medical knowledge somebody should know about. So I don't want to go more to advanced, but this is just basic thing like we should have at home.
Yeah. So if you maybe cut yourself, maybe while you're cooking your Christmas chicken, I pray none of that happens. So make sure you wash your hands properly. Use it's important to have gauze, bandages, so bandage it properly, change the bandages every day, every 2 days to ensure that the wound is healing properly. And if it's a deep cut, we will mention compression bandages. So before you even go to the hospital, you've already at least compressed or put pressure on the injury. And if it's a deep cut, you don't even know if any infection has come in. So you can go to the emergency in case you're worried about the tetanus infection and so on. And the chest compressions is important. We need to ensure that the ABCD is our usual guide: airway, breathing, circulation, and the environment. So learning how to do chest compressions is important before you even, before the ambulance comes. Also checking the environment, ensure that you are also safe to provide that help to the person, maybe if it happened on the street. But even within our immediate environment, we need to know how to take care of maybe bleeding and so on. It's important to have a first aid kit. And for children also growing, let's say at the age of 2 or under 2, we have some children in our community or in the church. We need to know about choking. So in case they put something in their nose or in their mouth, they maneuver about compressing their stomach, so, or beating their chest out. So ensure that you are aware. So the first aid is not just the first aid kit, it's first aid, what you do first in that moment. So knowing how to punch the back properly. So these are lessons or life skills that we need as adults in this day and age. All right.
Sorry to add to it.
Yes.
If you have kids, it's very important to have extra additional stuff. But I didn't mention like fever. You know, most time at the age of 2, 3, 4, 1, kids usually have fever. So you should have medications for that, and you should have thermometers to be able to measure their fever level because you want to know if they're 38, 39, 40, what you have to do. You should know, you should have medications for that at home to be able to bring down their fever and how to control the fever level. And if it's high, let's say continuously for like 2 days, or they're not drinking, they're not eating, they look fatigued, then you have to seek medical attention immediately. And and also you have to also consider if there's any case of allergy reaction. You know, you could also have some basic allergic medication, let's say skin rashes. You have like a Fenistil cream or some cream you can buy without prescription out of the counter medication to just put a cream on any rash, or let's say some people have mosquito bites and they even have reaction to it, like blisters and stuff. So you can have some cream you can put to it. So those are just many basic things you could have at home, you know.
Yes, yes. So go to the pharmacy and maybe just mention my child has rashes after mosquito bites. What do you recommend? So you go to the pharmacy, they're there to, you know, attend to you. Not all medications can be bought on the counter. Most of them, for example, like antibiotics and many others, need prescription from your doctor. So those that can be bought over the counter, your pharmacy can help you in making the right or buying the right medications for their age range, the recommended ones available or needed at that time. So what are the medical insurance or advantages available for the pregnant women in Hungary? That's one question that we have. I think in addition to the checkups, the medical checkups, breast examination, um, going to the gynecologist, and all of that are also part of the opportunities or part of the benefits you have with your TAJ card here. So for a pregnant woman, what are the advantages, or what insurance is available for a pregnant woman in Hungary?
I mean, what I would say is that for pregnant women, they have a broad range of protocol and procedures. So immediately you find out you're pregnant, the first is a gynecologist doing ultrasound and confirming the pregnancy. Immediately after that, you covered basically. I think there's a special coverage for that. I'm not 100% sure, but you can look into that. But if you have TAJ Card or private insurance, then you're good to go. From that moment on, there's a lot of procedures. The GP we get the documentation that okay, confirm the pregnancy, then they will give you a booklet of what you have to do. So it's so well detailed, like 6 weeks or 12 weeks, this is what you have to do. Then when you should return for a control test, I'm talking about blood tests and regular ultrasound, regular. So if there is a glucose test whereby they check your glucose level, they give you high amount of sugar to drink, then they check your glucose again. So there's so much test depending on which trimester you are, and covering everything on up all the way to delivery. So it's well detailed. So it's not a problem. But but I don't know if it just based. Let's say now the question is, let's say you don't have insurance, you don't have tie card, you don't have tie insurance, you don't have private insurance, you have nothing, and you're pregnant. So so now are you going to pay for the whole protocol, the whole procedures and the delivery, or this government is covering that as a special category? I'm not sure about that. That one I cannot answer.
Okay, thank you. So if you have insurance or even without it, make sure you go to the hospital, the gynecologist, confirm, and there are protocols that are in place for that, which they will lead you and guide you. So and ask questions. Ask questions what you need, if you need to pay, or this is covered by the insurance you have at that moment. But once you have your TAJ card here, these are usually covered by the um, healthcare service in Hungary. And someone mentioned, how can someone get TAJ card even as a non-citizen? Um, Thank you, Brother Justice, for sending this on the chat. So you can check the chat now, the payments or the amounts per month for adults and for children. So usually I would say go to the government office and ask this information, but it's possible to get the TAJ card, but you need to pay for it lump sum every month. For children born or for babies born in Hungary and outside Hungary, what medical advantages are available to them? For a child born in Hungary and one outside Hungary that just moved here after birth, what
Uh,
insurance are available to them?
for young kids, they have insurance. They can get so far since they're not working, the parents can, and if they have address card, they can get on green address card. Then they can apply for insurance, Thai card. The parents can help them to get a Thai card based also on the parent status as well, and also the address card too. So they covered. I mean, it's not, it also. What about their citizenship? Are they EU or non-EU? Do you know?
And non-EU.
Non-EU. I don't know. I don't know.
What about EU?
Of course, if it's EU, it's not a problem because with EU, they get address card because they have to show that they're not a tourist, that they living with their parents, that they're living in Hungary. Probably the dad is working or something like more than 6 months or a year. They have address card. They have if EU, they need to have the EU registration card that they registered to stay in Hungary as a temporary or permanent base, but not as a tourist, then with that, they can now go and apply for the Thai card. And obviously, the kids are covered immediately, automatically.
They're covered immediately. And in addition to what was mentioned about the kids having a thermometer to check their temperature, if you see they're getting sick, so it's important to write it down and take note of this. So if it gets worse and you have to go to the hospital, you have a background history of what has been going on in the past few hours or the past days. But it's important that you ensure you have some basic things as first in your first aid kits once you have children as well. Any further question? Any further question, please send on the chat. I think we've been able to cover most of it. Dr. Ife, is there any other thing that
I
you
mean,
want to add that
actually,
I
I'm
haven't?
open to more questions. Like, I'm thinking if somebody have questions about surgical procedures,
Yeah.
somebody have questions about operation, somebody have questions about uh, advanced medical cases or something like that. I'm happy to help. I don't want to start talking on broad
Okay. What
subjects.
about, yes, thank you. So going back to the operations, what when someone is going through some sort of chronic illness or maybe an acute case, they just found, oh, their lower right side has been aching for or has been sensitive for a long time or few days. What should they do in that moment?
The lower back is sensed pain.
Lower waist on the right side. So let's say signs of appendicitis.
Oh, okay, I see. Abdominal pain. Yeah, okay. Yeah, in case, so for example, if somebody have abdominal pain, it could be right-sided pain, or it could be even silent abdominal pain. It could even be from the other side because it's radiating to
Yeah.
another another place. But the thing is, like abdominal pain acutely, if you go to a GP, the GP can say, okay, if they fly to the hospital, or maybe you have so much chronic pain, but the GP is closed that time. Obviously, you can't wait for your GP if you really are not feeling well. So you could just go straight to the emergency department and they will check you out and they can make a diagnosis of appendicitis. And from that on, then they will refer you to the correct place, surgical department. And another case I want to talk about is throat pain. So you could have a throat pain and maybe you try to use antibiotics or you try to use painkillers and it's not getting better. You go to your GP and maybe you couldn't see your GP if you go to ENT or hospital. So you got basically some cases in Hungary you can actually go to your GP. Like if you have TAJ card, you have that freedom. So you can go to your GP. But in some cases, even if you don't want to go directly to your GP, let's say now you have a throat pain and you want to see ENT doctor, usually you can go to your GP. Of course, GP will try to tell you go to ENT. But there's another option also that in the hospital where you are based or like allocated to, you can call the ENT outpatient department and you can book appointment. Or you can call the gynecology outpatient department and you can book appointment. So you can call outpatient department and also book appointment and they can now say, okay, bring GP referral notes, or some of them will say, don't bring. For example, in my ENT outpatient clinic, we don't ask for GP referral paper. If you book an appointment, you're on an appointment with us, you come, we don't ask you for GP referral paper. We just treat you, straight up. So, so we should just be mindful of taking good care of our health. That's it.
Okay. What should one do when they have a GP who is not very cooperative or helpful, coupled with the language barrier?
Yes, that's a good question. You have the right to change your GP. So your GP is so it's not like prison that you don't have to be stuck with a GP that you do not like. So if for whatever reason, so maybe you are in a city, let's say you are in Zagreb now, you will have like what? I mean GP, so many. And you first of all with one GP, you don't like that GP for whatever reason, and you have the right to say to that GP, you want to deregister yourself. It's no problem. They said to GP, you want to deregister yourself and you get your deregistration papers and you can also go to another GP and register. It's not a problem. That's why I say it's good to actually find out information before you register to a GP. Like for me, I would say ask around. Like just ask around, like if you can find somebody and say, look, that GP, what do you think? Find any information like, okay, that GP, oh, yeah. So of course, everybody have different opinions. Some people would say something. So not everybody will say, oh, they like. So you can't just 100% judge based on that, but at least you can have an overview of what that GP is, and just give it a try. And but if along the line, if you have issues or for real you have real issues and you don't like the GP, then you have the right to change your GP without any problem.
I mean, many people, we have the impression that you can't change your GP because you are registered per your address. So how do we go about changing that? I think you just mentioned getting the registration papers, and many a times when you go to another GP who is not assigned to your address, some of them don't have the capacity to take on new persons, and some of them do have that capacity. So it's important you ask around and check.
Most time it's good for the GP to take more because actually they pay based on how many cards you have. So most time the GP, the more card you have, the more money you making. So basically, it's good for the GP that wants to actually make money to get more patient. Because sometimes many patients are registered to you as a GP, but you don't even see them in 1 year. They are on your list as they don't even come to disturb you, so you don't even see them. Like some GP have 2,000 patients on their list, but out of that 2,000, probably 200 is what they focus on, and that 200, there's one that's coming every day. Out of that 200, one is coming every day knocking the door. So some almost 1,000 not even bothering them, So most time I mean, if in real GP, okay, there's a max amount, obviously, but most time, most GP won't mind if you want to switch to them. They don't have any problem with that. You don't even need to explain. You don't even need to say, oh, why am I leaving? No, you don't have no reason to explain. Just go to a GP you don't know, like, yeah, you have a valid reason. You should just do register yourself, get your papers, and you go to a new GP and register. That's it.
Okay. If you have a private insurance, is it possible to still apply to a GP in your district?
Yes, if you have private insurance, yeah, you can apply to a GP. Yeah, but it depends if you're a student also. It depends or you working. So the question is not totally clear because for a
Like,
student,
for someone who is working, I
yeah,
think.
you have address card and you have private insurance and you have address card. Yeah, it'd be good to go to your GP and register. Now, if the GP is saying for whatever reason does you only want valid Thai card, then you should contact your insurance company and the insurance will tell you which GP you can register with because some GP also cover public and private insurance. So call your insurance company and ask them like which GP can you register with, and they will tell you.
Okay. And one of our last few questions for someone with both Thai card and private insurance, which is best recommended for the periodic medical checkup? For someone who has a Thai card and private insurance, which should they choose for periodic medical checkup?
That's a very good question. It's luxurious to have the two anyway in the first place. So if you have the two, you're doing good already. So you have options then. So the private would be better in the sense that probably it's faster because private, since you cover private insurance, you just walk in and they do your blood test straight up without blinking, or your X-ray. You don't need to book an appointment that much. Private is faster. Public is also good. It depends where you live. So in the countryside, public, they will also do your test quickly. The long waiting list. But it depends on if you live in a busy location, busy area, maybe you have to wait a bit to get blood test or X-ray. But these things, even if you need to wait for a few days, so it's not that bad at all. So anyone is actually good. But obviously, I guess private is faster.
Okay. I think I mean, not that I think we've answered all the questions that have been mentioned or that people have come up with, and we've gone through as much as we can. So our take home message for today is important that following a good diet, drinking enough water, 2.5 liters, 3 liters a day of liquid, so including tea and everything is important. We need to have a good diet, drink water, adequate amounts of water, so we are not dehydrated. Many people are scared, oh, I will end up going to the toilet too much, but it's good for your system. You need to drink water. You need to eat well, eat vegetables, cook properly, because there you can get the micronutrients, the macronutrients that we need for our body to, function properly. Eat good food, cook your food, don't be dependent on fast food every time. I'm not saying that does not happen, but it's important that we go to the market, cook a good meal. And exercising is important. Exercising is important. Choose an activity that, let's say, wouldn't give you too much stress, that you can easily do. And sometimes it just comes with discipline. You have to start doing it, and it eventually becomes a habit. Sometimes even just workouts at home, watching a dance routine on YouTube. Many exercises are available, and having a complete first aid kit at home, and ensuring you know CPR procedures, how to do the Heimlich maneuver for choking. So it's important as well. So everything that we've mentioned today, this is a summary from my side. Dr. Ife, any?
I mean, you covered everything, and I mean, what I could add, probably we should consider what we take in. I mean, the food. What I mean, like, it's not just about cooking; it's about what are we eating. So some things like it seems, how can I say, like let's say now, a lot of people eat a lot of food like bacon or fatty food that probably tastes good, but doesn't mean like it's good for your health in the long run. And also, we need to, like, if you don't drink enough water, what you said is not good. And also, where you live, you have to kind of like be in a clean environment. Not just that, the ventilation, your airflow is very important, because you want your breathing, because dust going to your nose or particles going to your nose, or you don't have fresh air going to your nose, it's not good. It causes different problems. So, well, all the lot of general things like we have to consider. We talk about exercise or your stress management, your mental well-being, social network to be able to have inner peace and happiness. And also, we talk about medical checkup, which is very important. It's just if you don't have any problem, then you start to do medical checkup. Or if you have issues, then you have to seek help immediately. And we should always seek help right on time, not at the last minute when it's an advanced case. So that's all.
Okay. Do you want to broaden about the airflow? What should we do in the winter?
Yeah, okay, that's very important because it depends on where you live. Let's say now we go out to consider the heating system. So if you don't want to pay so much bill, right? So because many people be like, oh, let me close all the windows and doors because I don't want to pay because of the bills, the gas bill or what. At the end of the day, it's not really helpful. That sometimes in a day, at least few times in a day, you should open the window and just allow fresh air to flow in. And even if you're at home all day, sometimes try to go out and just, even if it's cold, I know, but if it's just 5 minutes or few minutes, just go out and have fresh air in your system, not just being at home all day and you close all the windows and doors and nothing is coming in. It's not really good. So even if let's say weekend now you're at home, or sometimes just open the window just for a few minutes, just let it flow, and after a while you close it back. So it's very, very important. Even that's why I say if you go out and sometimes exercise or leave the house sometimes just to get a fresh air, it's very, very important for your lungs.
Yes, and I think many houses come with carbon monoxide detectors. So if they're one of the signs are dizziness and sluggishness and fatigue, so we need to pay attention to getting an appropriate detector in our houses, and also ensuring that airflow comes into our house as much as it's cold or we are locked up. Sometimes many people are still have the hybrid or remote working. So ensure you step out, get fresh air, interact with people, and I pray that the Almighty God will give us the grace and the ability to make take this knowledge we've had today and implement them in our lives in Jesus' name. Thank you
Amen.
very much, Dr. Ife. Thank you very much, everyone, for attending. Thank you very much. God bless you. Over
Thank
to
you. Thank you too. Bye.